how to talk to your doctor with me, Mary Allison. Going to the doctor is something most people despise. First comes the wait, then the dreaded weigh-in, more waiting, and some poking and prodding. Although visiting the doctor is no day at the beach, it is important that we all make regular visits and form a relationship with our doctor. For individuals with a disability, this is especially true. As a person who has been living with a spinal cord injury for over 20 years, I've had my fair share of doctor's appointments. Some have been pleasant experiences and some have been downright traumatic. But over the years, I've learned a few tricks that can ease the awkwardness of an appointment and improve the patient-doctor relationship. The first step to creating a positive doctor's visit is finding the right doctor. Ideally, you should have a doctor that specializes in your disability or health condition in addition to someone who provides your primary care. But if you live in a rural area or don't have access to a specialist on a regular basis, it's important that your doctor understands your disability and any medical or lifestyle issues related to it. Doctors spend years studying and practicing their profession, but no person or doctor can ever fully understand a disability or health condition unless he or she personally experiences it. We as patients can't hold this against our doctors. We must realize that it is our job to educate and inform our doctors about the specifics and nuances regarding our disabilities and health conditions. Now, to do this, you don't have to reveal your deepest, darkest secret or most embarrassing disability story, but you do need to get a little personal. When I first meet a doctor, I always take a little time to tell him or her about myself. I mention my husband, my job, my leisure activities. This allows my doctor to see beyond my disability and relate to me as a human, not a chart. After you share a bit about your lifestyle, be prepared to share your health history with your doctor. It is important to know the name of your disability or health condition, when it was acquired, and any medications you take to treat it. The more you know about past surgeries, medical procedures, or complications, the easier it will be for your doctor to formulate a treatment plan. Once your doctor knows a little bit about your lifestyle and health history, share some goals you have set for yourself and how they relate to your disability or health condition. For example, if you want to increase your independence in transferring but are limited by leg spasticity, share that goal and issue with your doctor. Your doctor may be able to recommend some stretches you can do to decrease spasticity or medication if the spasticity is more severe. Always ask about alternative methods of treatment aside from medication alone. For example, if your weight in addition to your spasticity is preventing you from independently transferring, then your doctor may connect you with a weight management counselor. The counselor may suggest a fitness or swimming regimen that would increase flexibility and strength, decrease spasticity, and allow you to independently transfer. Sharing goals with your doctor is also a way to ease into awkward topics like sex, bowel programs, and pressure sores. For example, if your goal is to take a vacation with a group of friends, but you're worried about the time it takes to complete your bowel program and the insecurity you feel during long car rides, share that with your doctor. Tell him or her that you want to feel comfortable around your friends and not be the stink bomb in the back seat. This will give your doctor an understanding of why your current bowel program is not working and what he or she can do to make it work better. Similarly, if you are new to your disability and unsure how to tackle the topic of intimacy, turn it into a goal. Tell your doctor that you are looking to date, but you want to make sure you're fully prepared physically for intimacy before you find that special someone. The way you approach the awkward topic will influence your doctor's reaction and treatment method. If you present your concerns as real-world problems rather than symptoms, you and your doctor will be able to figure out the most practical solution. It's important to remember that doctors, just like patients, are human. Your doctor may not have all the answers or be able to cure you of your disability or health condition. But through open dialogue, you and your doctor can formulate a treatment plan to help you be as healthy, active, and independent as possible with the body you have. And that, to me, sounds like a positive experience. Your doctor may be able to recommend some stretches you can do to decrease spasticity. Spasticity. The counselor may suggest fitness or a swimming. The counselor may suggest fitness or swimming. I left out an A. Sorry. Okay. And the insecurity. I'm going too fast. and the insecurity you feel during long car rides. If you present your concerns as real word, this is how you do it. I've learned a few tricks that can ease the awkwardness as it eases on down. Always act. The counselor may suggest fitness or swimming. I left out the A. Oh, can I take a break?
Yes.